What is acetyl-L-Carnitine? In the body, acetyl-L-Carnitine is made from L-carnitine. It can also be converted to L-carnitine. L-carnitine is an amino acid, a building block for proteins, that is naturally produced in the body. It helps produce energy. Although it is an amino acid, L-carnitine is not used to make proteins. What is acetyl-L-Carnitine used for? Acetyl-L-Carnitine is used for a variety of mental disorders including Alzheimer's disease, age-related memory loss, late-life depression, thinking problems related to alcoholism, thinking problems related to Lyme disease, and thinking problems related to very poor liver function, hepatic encephalopathy. It is also used for withdrawal from alcohol, Down syndrome, bipolar disorder, poor circulation in the brain after a stroke, cataracts, nerve pain due to diabetes, nerve pain due to drugs used in the treatment of AIDS or cancer, nerve pain caused by sciatica, fibromyalgia, and facial paralysis. Acetyl-L-Carnitine is used for tiredness related to getting older, tiredness related to a disease called multiple sclerosis, a muscle wasting disease called amyotrophic lateral sclerosis, high levels of activity in children with the genetic condition Fragile X syndrome, and attention deficit hyperactivity disorder, ADHD. It is also used for aging skin. Some men use acetyl-L-Carnitine for infertility, symptoms of male menopause, low testosterone levels due to aging, and a disease of the penis called Peyronie's disease. Acetyl-L-Carnitine is given intravenously, by 4, for alcohol withdrawal, nerve pain caused by antiviral drugs used to treat HIV, dementia, and reduced blood flow in the brain. Acetyl-L-Carnitine is injected into the muscle for a pain condition called fibromyalgia as well as nerve pain that typically affects the hands and feet, peripheral neuropathy. The body can convert L-carnitine to acetyl-L-carnitine and vice versa. But no one knows whether the effects of acetyl-L-carnitine are from the chemical itself, from the L-carnitine it can make, or from some other chemical made along the way. For now, don't substitute one form of carnitine for another. How does it work? Acetyl-L-Carnitine helps the body produce energy. It is important for heart and brain function, muscle movement, and many other body processes. Uses and effectiveness. Possibly effective for improving memory problems in elderly people. Taking acetyl-L-Carnitine improves memory and mental function in older people with some memory loss. Tiredness in older people. Taking acetyl-L-Carnitine improves feelings of mental and physical tiredness in older people. It also appears to reduce feelings of tiredness after exercise. Age-related testosterone deficiency, male menopause. Taking acetyl-L-Carnitine by mouth along with propionyl L-carnitine seems to help symptoms related to declining male hormone levels. This combination taken for 6 months seems to improve sexual dysfunction, depression, and fatigue in much the same way the male hormone testosterone does. Alcohol withdrawal. When given intravenously, by 4, for 10 days then taken by mouth for 80 days, acetyl-L-Carnitine helps reduce withdrawal symptoms and increase the amount of time before another alcoholic drink is consumed. However, most of the symptom improvement occurs during the first week. Therefore, it's not clear if taking acetyl-L-Carnitine by mouth offers further benefit following 4 treatment. Treating Alzheimer's disease. Acetyl-L-Carnitine might slow the rate of disease progression, improve memory, and improve some measures of mental function and behavior in some patients with Alzheimer's disease. It is more likely to help those with early-onset Alzheimer's disease who are less than 66 years of age and have a faster rate of disease progression and mental decline. Poor blood flow to the brain. Administering a single dose of acetyl-L-Carnitine intravenously, by 4, seems to produce short-term improvements in blood flow in the brains of people who have poor blood circulation in the brain. Improving memory in alcoholics. Taking acetyl-L-Carnitine seems to improve memory in 30 to 60-year-old people whose use of alcohol has produced long-term thinking problems. Reducing nerve pain, neuropathy, caused by diabetes. Taking acetyl-L-Carnitine seems to improve symptoms in people with nerve pain caused by diabetes. Acetyl-L-Carnitine seems to work best in people who have not had diabetes for a long time or who have poorly controlled type 2 diabetes. Also, doses of 1,000 mg taken 2 or 3 times daily seems to work better than doses of 500 mg 3 times daily. Poor brain function in people with liver failure, hepatic encephalopathy. Taking acetyl-L-Carnitine improves physical function and may improve mental function in people with poor brain function due to liver failure. It also might improve liver function, as indicated by reduced blood levels of ammonia. Treating male infertility. Taking acetyl-L-Carnitine by mouth, along with L-Carnitine, seems to increase sperm motion and may increase the rate of pregnancy in infertile men. Also, taking acetyl-L-Carnitine and L-Carnitine after treatment with non-steroidal anti-inflammatory drugs, NSAIDs, seems to improve sperm count and sperm movement in men with infertility caused by a swelling of the prostate gland, seminal vesicles, and epididymis. In addition, taking a combination of acetyl-L-Carnitine, L-Carnitine, L-arginine, and Panax ginseng seems to increase sperm movement in men with infertility due to reduced sperm movement. It might also increase sperm movement and sperm count in men with infertility due to prostate swelling caused by chlamydia infection. Treating Peyronie's disease, a connective tissue disease in men. Acetyl-L-Carnitine seems to be more effective than a drug called tamoxifen for reducing pain and slowing worsening of the condition. Possibly ineffective for reducing nerve pain, neuropathy, caused by chemotherapy. Acetyl-L-Carnitine might not reduce neuropathy associated with chemotherapy in cancer patients. In fact, it might make it worse. But it's possible that severe nerve pain caused by chemotherapy might be reduced by a small amount, even if the time the pain lasts is not reduced. Insufficient evidence to rate effectiveness for muscle wasting due to amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease. Early research suggests that taking acetyl-L-Carnitine along with the drug riluzole reduces the number of people with ALS who lose self-sufficiency compared to taking riluzole alone. It also seems to increase survival and improve physical function. Reducing nerve pain, neuropathy, caused by HIV treatment. Early research suggests that taking acetyl-L-Carnitine by mouth might reduce nerve pain caused by antiretroviral treatment. However, acetyl-L-Carnitine does not seem to work when injected into the muscle. Attention Deficit Hyperactivity Disorder, ADHD. Taking acetyl-L-Carnitine does not seem to improve symptoms of ADHD in children already treated with methylphenidate. Bipolar disorder. Taking acetyl-L-Carnitine plus alpha-lipoic acid for 12 weeks does not seem to improve symptoms of depression in people with bipolar disorder. Depression. Early research suggests that acetyl-L-Carnitine might improve mood and decrease depression in elderly people. Fibromyalgia. When injected into the muscle or taken by mouth, acetyl-L-Carnitine appears to reduce some symptoms of fibromyalgia. The greatest benefit seems to be achieved when acetyl-L-Carnitine is given using both routes. A genetic condition called Fragile X syndrome. Early research suggests that acetyl-L-Carnitine does not improve mental function but might reduce hyperactive behavior in children with Fragile X syndrome. Multiple sclerosis. Early research suggests that taking acetyl-L-Carnitine might reduce feelings of tiredness in people with multiple sclerosis. Pain due to pressure on the sciatic nerve in the lower back, sciatica. Early research suggests that taking acetyl-L-Carnitine reduces the need for pain medication in people with sciatica. However, it is not as effective as the supplement alpha-lipoic acid. Cataracts. Down syndrome. Thinking problems related to Lyme disease. Other conditions. More evidence is needed to rate the effectiveness of acetyl-L-Carnitine for these uses. Side effects. Acetyl-L-Carnitine is likely safe for most adults and possibly safe for most children when taken by mouth. It can cause some side effects including stomach upset, nausea, vomiting, dry mouth, headache, and restlessness. It can also cause a fishy odor of the urine, breath, and sweat. Acetyl-L-Carnitine is possibly safe for most adults when given by another route than by mouth. Used only under medical supervision. Special precautions and warnings. Pregnancy and breastfeeding. Not enough is known about the use of acetyl-L-carnitine during pregnancy and breastfeeding. Stay on the safe side and avoid use. Nerve pain, neuropathy, caused by chemotherapy. Acetyl-L-carnitine might worsen symptoms in some people with nerve pain caused by a class of chemotherapy drugs known as taxanes. Underactive thyroid, hypothyroidism. There is some concern that acetyl-L-carnitine might interfere with thyroid hormone. Don't use acetyl-L-carnitine if you have an underactive thyroid. Seizures. An increase in the number or seriousness of seizures has been reported in people with a history of seizures who have used L-carnitine by mouth or by intravenously. Since L-carnitine is related to acetyl-L-carnitine, there is a concern that this might also occur with acetyl-L-carnitine. If you have ever had a seizure, don't take acetyl-L-carnitine. Interactions. Acinocumarol syndrome, interaction rating, major. Do not take this combination. Acinocumarol syndrome is used to slow blood clotting. Acetyl-L-carnitine might increase the effectiveness of acinocumarol syndrome. Increasing the effectiveness of acinocumarol syndrome might slow blood clotting too much. This might increase the change of bruising and bleeding. The dose of your acinocumarol syndrome might need to be changed. Warfarin, Coumadin, interaction rating, moderate. Be cautious with this combination. Talk with your health provider. Warfarin, Coumadin, is used to slow blood clotting. Acetyl-L-carnitine might increase the effects of warfarin, Coumadin, and increase the chances of bruising and bleeding. Be sure to have your blood checked regularly. The dose of your warfarin, Coumadin, might need to be changed. Dosing. The following doses have been studied in scientific research. By mouth. For age-related memory loss, 1,500 to 2,000 milligrams of acetyl-L-carnitine has been used daily for 3 months. For age-related tiredness, 2 grams of acetyl-L-carnitine has been used twice daily for 180 days. For age-related testosterone deficiency, 2 grams of acetyl-L-carnitine plus 2 grams of propionyl L-carnitine has been used daily for 6 months. For alcohol withdrawal, 1 to 3 grams of acetyl-L-carnitine has been administered by 4 for 10 days. Then, for the next 80 days, 3 grams of acetyl-L-carnitine has been taken by mouth daily. For Alzheimer's disease, 1,500 to 3,000 milligrams of acetyl-L-carnitine has been taken by mouth daily in 2 or 3 divided doses for 3 to 12 months. For improving memory in people who use alcohol excessively, 2 grams of acetyl-L-carnitine has been used daily for 90 days. For nerve pain in people with diabetes, 1,500 to 3,000 milligrams of acetyl-L-carnitine has been taken by mouth daily in divided doses for 1 year. In some cases, 1,000 milligrams of acetyl-L-carnitine was injected into the muscles for 10 to 15 days before it was taken by mouth. For poor brain function in people with liver disease, hepatic encephalopathy, 2 grams of acetyl-L-carnitine has been taken twice daily for 90 days. For male infertility, 1 gram of acetyl-L-carnitine plus 2 grams of L-carnitine has been taken daily to treat male infertility. For male infertility secondary to abacterial prostatavesiculoepididymitis, 500 milligrams of acetyl-L-carnitine plus 1 gram of L-carnitine every 12 hours has been used following 2 months of treatment with non-steroidal anti-inflammatory drugs, NSAIDs. For male infertility due to low sperm movement, a combination containing 1,660 milligrams of L-arginine, 150 milligrams of L-carnitine, 50 milligrams of acetyl-L-carnitine, and 200 milligrams of Panax ginseng has been taken daily for 3 months. For male infertility due to prostate swelling caused by chlamydia infection, a combination containing 1,660 milligrams of L-arginine, 150 milligrams of L-carnitine, 50 milligrams of acetyl-L-carnitine, and 200 milligrams of Panax ginseng has been taken daily for 6 months along with 600 milligrams of prolifloxacin. For Peyronie's disease, 1 gram of acetyl-L-carnitine has been taken twice daily for 3 months. By 4. For alcohol withdrawal, 1 to 3 grams of Acetyl-L-Carnitine has been given by 4 over 3 to 4 hours for 10 days. Thereafter, 3 grams of Acetyl-L-Carnitine has been taken by mouth daily for 80 days. For improving blood flow to the brain, a single dose of 1,500 milligrams of Acetyl-L-Carnitine has been given by 4 as a shot. For nerve pain caused by diabetes, 1,000 milligrams of Acetyl-L-Carnitine has been given as a shot daily for 10 to 15 days. In some cases, 2,000 milligrams of Acetyl-L-Carnitine has been taken by mouth daily for 12 months following the shots.